Thanks for staying with us. Let's go back to this conversation. The South African National Blood Service continues its battle to increase its reserves. The organisation says blood donations have decreased drastically over the previous year. Now, with blood stocks at a critical low, things might be bad for those in need of blood transfusions. Let's speak now to Dr. Karin van der Berg, who is the medical director at the South African National Blood Service. Thank you so much, Dr. van der Berg, for your time. I'm hoping that it's a better line now. The organisation is currently below the 5-day supply that has been recommended by the World Health Organization. I wonder, what would you attribute this current shortage to?
Well, definitely at this stage, we would attribute this shortage to the impact of the COVID epidemic on both the ability of the blood services to collect blood, but also in the really unpredictable demand that we have seen over the last 18 to 24 months.
And are you able to quantify just how much the pool of donors has shrunk?
Yes, indeed. Not only have we lost about 20% of our regular donors, we have also been unable to grow the donor pool. So every year we try and attract about 10% new donors, people who've never donated before, because obviously over time, people have to stop donating due to health reasons or other reasons. And so one needs to replenish your donor pool all the time. And we have not come anywhere near the 10 to 15% new donors that we have been, we've been, aiming for. That combined with the decrease in 20% of the donor pool has just had a really dramatic impact on us.
And you talk about the pandemic having had an impact on the reserves at this time. Let's talk about some of the reasons then that you've established behind, people simply choosing not to donate blood.
Well, it is both people choosing not to donate blood, but it is also because we haven't been able to get to our donors in the way that we normally would be able to go to them. So, for example, at large employment groups or venues where you would be able to go and there would be 200-300 people working in a building. When you go there now, 3/4 of those people are working from home. And so the number of people available to actually come and donate blood is very limited. We see the same thing happening at the schools and universities and so forth. So historically, about 60% of our blood was collected from these mobile blood drives. That has shrunk dramatically. And so it's that. It's also because, we take the safety of our donors and our staff extremely seriously. And so we have very strict COVID precautions and regulations in place, which means that it takes, a couple of minutes longer to collect a unit of blood compared to the pre-COVID days. And so all of these things contribute to the number of donors actually going through our doors decreasing over time.
And I also, have seen some concerns around those who've had COVID-19 and have since recovered, who are worried that they might not be eligible to donate blood, given the fact that they've contracted COVID. Are they safe to be able to come and give their blood?
Oh, yes, definitely. And I think this is a really important issue to address because there's so much misinformation on the social media and elsewhere. So definitely if you've had COVID, regardless of the variant you had, once you have recovered, you are welcome to come and donate. It is safe for you to come and donate. And the blood that you are donating is safe for patients. So generally we say if you have had a mild case or an asymptomatic case of COVID, you are welcome to come back after about a week or two, 14 days. And this is really just to give you time to completely recover and make sure that you are no longer infectious. But if you've been more sick and you were admitted to hospital, then really you need to take a couple of weeks just to regain your strength, and then you can come and donate.
And another misconception that I see in the public domain is around vaccination, and the people saying that if I'm in hospital and I'm not vaccinated as yet, but I do get a blood transfusion of somebody whose blood, of a person who has been vaccinated, that means that now I don't necessarily need to go for my own vaccination shot. That simply cannot be true.
No, it is not. It's emphatically not true. The vaccine works that it stimulates, once you are vaccinated, it stimulates your body to make antibodies. Us giving you by chance some antibodies as part of a blood transfusion is not a vaccination, and you will not make your own antibodies in response. Besides all of the other issues, when you get a red blood cell transfusion, you get only a very small amount of the plasma part of the blood that contains the antibodies. So you are not even going to have a large number of the vaccinated person's antibodies. So I think it's really important to understand that getting blood from a vaccinated person is firstly safe. There is loads of scientific publications in the mainstream scientific media to confirm the safety of such blood products. And then secondly, you are not going to have protection against COVID if you receive blood from a vaccinated person. So I think those are two really important misconceptions for us to clarify.
The shortage definitely must have had an impact on, patients who donate, who in fact rely on blood transfusion. But I wonder also, how much pressure have the shortages added to the staff?
During December, we had towards the end of December, and then in January, we had to go into a system which we refer to as Cutbacks, meaning that when doctors request blood for a patient, depending on how serious the patient's condition is, if the doctor wanted 2 units of blood, we would only be able to issue 1 unit. And that really places a tremendous amount of strain on our system, on our staff, having to, in addition to their normal work, having to contact doctors, explain to them the situation. But emotionally, it places a tremendous burden on our staff. We truly live our motto of being trusted to save lives at SABC. And when we have to make this judgment call about this patient we're going to give 2 units of blood for, and that patient's only going to get 1, or potentially not even 1 today, only 1 tomorrow. The stress, the emotional stress on our staff is just unbelievable. And that feeds out throughout our entire organization. But it also feeds into family members of the patients and the patients themselves. We have cancer patients having to wait an extra day in hospital, hoping that tomorrow there would be blood for them. So it is a tremendous emotional stress, but it increases the cost of us being able to deliver products, because we have to courier it same day. All of those things are associated with significant costs.
All right, certainly hope that the reserves improve speedily, Doctor. We thank you so much for your time. That was Dr. Karin van den Berg. She's the Medical Director at the South African National Blood Service. Let's remind you of the headlines at this hour.